Hello, welcome back to my channel. I'm Nurse Jackson. Today I'm going to be discussing UTIs or urinary tract infections. Disclaimer, the information in this video is for educational purposes only. It is not intended to diagnose or treat any illnesses. Please remember to subscribe to my channel after viewing the video. What is a urinary tract infection? A urinary tract infection is an infection in any part of the urinary system, which consists of the kidneys, the ureters, the bladder, and the urethra. But most infections occur in the lower part of the urinary tract, which consists of the bladder and the urethra. Women are at a greater risk of developing a UTI than men because of the anatomy of a woman's genitalia. Women have a shorter urethra that allows bacteria to easily ascend into the bladder. The organism that is primarily responsible for a urinary tract infection is called E. coli, which is a gram-negative bacteria that's found in the lower part of the intestinal tract. Risk factors for developing a UTI or urinary tract infection include sexual intercourse. If you have sexual intercourse or if you have sex and you don't urinate afterwards or clean your vagina, you increase the risk of developing a UTI. Also, if you wait too long to urinate, let's say you're at work, let's say you're shopping at the mall, you're on the phone, you're watching TV, you're cooking, you're cleaning the house, talking to the neighbor, and you have to urinate and you hold it and you don't go right away, don't do that. Holding your urine in your bladder for an extended period of time increases your risk of developing a UTI. Other risk factors or other factors that can increase the risk of developing a UTI include using certain types of birth control, antibiotic resistance. If you have recurring urinary tract infections and you're constantly using antibiotics, that can increase the likelihood of developing a UTI because you become resistant to the antibiotic. Being menopausal, genetics can increase the risk of developing the risk of a UTI. Using certain feminine hygiene products that have scents, using scented bubble baths, that can increase your risk of developing a urinary tract infection. If you're hospitalized and they insert a Foley catheter, that can increase the risk of a woman developing a urinary tract infection. So there are so many different variables or factors that can increase a person's risk of developing a urinary tract infection. Some signs of a urinary tract infection include frequent urination, having a burning sensation when you urinate. These are signs of a urinary tract infection. Hematuria or blood in the urine. Having a persistent urge to urinate. Let's say you're out on a date with your boo. You've been talking to this dude on the phone for a minute, right? And then you guys go out to dinner. You're sitting at the table like, okay, excuse me, be right back. You go to urinate, come back. You still like you gotta go. You feel like you gotta go again. Having that strong sense or that urgency or that persistent urge to urinate is a sign of a urinary tract infection. If your urine has a foul odor, if you have pelvic pain, these are all signs of a urinary tract infection. Again, let's review the signs of a urinary tract infection. Having a burning sensation when you urinate, frequent urination, having a strong or persistent urge to urinate, hematuria or blood in the urine, urine that appears cloudy, having strong smelling urine, pelvic pain in women when they urinate. These are all signs of a urinary tract infection. Now, how can you avoid a urinary tract infections? Well, it's important to drink plenty of water. When you drink water, what happens is you're diluting your urine and it helps to flush out the bacteria from your urinary tract. This decreases the likelihood of developing a UTI. Drinking cranberry juice or using cranberry products. Studies have shown if you drink cranberry juice or use cranberry products, this can help you to avoid developing a urinary tract infection. Caveat, if you're on certain medications like Coumadin or warfarin, if you take omeprazole, which is Prilosec, that's a proton pump inhibitor and that prevents acid from being secreted in the stomach, you want to avoid cranberry juice. If you take aspirin or Lipitor, if you're on Femara, which is a breast cancer treatment medication that's prescribed to women who are postmenopausal, you want to avoid cranberry juice because what happens is the cranberry juice can possibly interact with these medications. So you want to make sure you talk to your medical doctor if you're taking any medications and you're not sure before you use the cranberry juice to prevent urinary tract infections. Now, some other tips to avoid a urinary tract infection include you want to make sure you wipe from front to back. Do not wipe from back to front because you don't want to introduce any bacteria into your urinary tract. So you want to make sure you wipe from front to back. You want to make sure you avoid using those scented feminine hygiene products. Make sure you avoid using scented bubble bath, because these are very important in order to prevent you developing a urinary tract infection. After having sex, you need to make sure you make sure you clean your vagina, okay? Very, very important to prevent a urinary tract infection. Thank you so much for watching. Please remember to subscribe to my channel. And remember, take care. God bless. If you have symptoms of a urinary tract infection, please consult your medical doctor because only a medical doctor can diagnose a urinary tract infection by performing a urinalysis and by also doing a culture. Thank you so much for watching. Take care. God bless. Bye-bye.